Common UTI causes and how to prevent them. Urinary tract infections, or UTIs, are a common issue that many people face. They happen when harmful bacteria enter the urinary tract, which includes the bladder, urethra, ureters, and kidneys. The most frequent culprit is a type of bacteria called Escherichia coli, or E. coli, which often comes from the digestive tract. This bacteria can spread from the anus to the urethra and then move up into the bladder. Women are at a higher risk for UTIs because their urethra is shorter and closer to the anus, making it easier for bacteria to enter. Several factors can increase the risk of developing a UTI. Sexual activity can introduce bacteria into the urinary tract. The use of spermicides can also disrupt the natural balance of bacteria in the vagina. Changes in vaginal flora, especially during menopause, can play a role as well. Pregnancy can increase the risk due to hormonal changes and pressure on the bladder. Structural abnormalities in the urinary tract can also make someone more prone to infections. Poor hygiene practices and holding urine for long periods can further contribute to the risk. To help prevent UTIs and maintain bladder health, there are several evidence-based strategies you can follow. First, staying well hydrated is crucial. Drinking plenty of water helps dilute urine and flush out bacteria from the urinary tract. Aim for urine that is pale yellow, which indicates good hydration. Studies show that increased fluid intake can significantly reduce the chances of recurring UTIs. Practicing good hygiene is another important step. Always wipe from front to back after using the toilet to prevent bacteria from the anal area from reaching the urethra. Keeping the genital area clean and dry is essential, and it is best to avoid scented soaps, douches, or powders that can irritate the urethra. Regularly urinating and fully emptying your bladder is also key. Avoid holding urine for long periods, as this allows bacteria to multiply. It is a good idea to urinate soon after sexual intercourse to help flush out any bacteria that may have been introduced. Choosing the right underwear and clothing can make a difference too. Opt for breathable cotton underwear instead of tight or synthetic fabrics that can trap moisture and promote bacterial growth. Additionally, limit the use of irritants such as spermicides and scented feminine hygiene products, as well as excessive alcohol or sugary foods and drinks. For pregnant individuals, being especially vigilant about UTI prevention is important since UTIs can lead to complications like preterm birth. If you have structural issues in your urinary tract or other health conditions, it is best to work with a healthcare provider to develop a tailored prevention strategy. Some people consider using D-mannose, a sugar supplement, or cranberry products to help prevent recurrent UTIs. However, it is important to discuss these options with a healthcare provider, especially if you are pregnant or taking certain medications. From the perspective of bladder health, preventing recurrent UTIs is vital. Chronic bladder infections can cause inflammation and irritation, which may complicate bladder health. While UTIs are not a direct cause of bladder cancer, maintaining a healthy urinary tract reduces overall bladder stress and supports early detection of any abnormalities. If you experience symptoms of a UTI or have concerns about bladder health, always seek professional medical advice. Prompt diagnosis and treatment are essential to prevent complications and maintain good bladder health.